Welcome to NurseNextStation, nurturing future nurses one quiz at a time. Today, we're diving into 10 board-style pharmacology questions designed to sharpen your critical thinking and prepare you for the nursing licensure exam. Ready to test your knowledge? Let's begin. Question 1. A client is prescribed Digoxin. Which of the following findings should the nurse report to the provider immediately? A. Heart rate of 58 beats per minute. B. Nausea and anorexia. C. Serum potassium of 3.0 milliequivalents per liter. Or D. Digoxin level of 0.9 nanograms per milliliter. The correct answer is letter C. Serum potassium of 3.0 milliequivalents per liter. Hypokalemia significantly increases the risk of digoxin toxicity. A potassium level of 3.0 is critically low and must be reported immediately. Question 2. Which instruction should the nurse give to a patient prescribed tetracycline? A. Take it with milk to reduce stomach upset. B. Avoid sun exposure while on this medication. C. You may stop taking it once you feel better. D. Take it with antacids for faster absorption. Correct answer. B. Avoid sun exposure. Tetracyclines increase sensitivity to sunlight, making the skin prone to sunburn. Patients should be taught to avoid prolonged sun exposure. Question 3. A patient with asthma is prescribed theophylline. Which of the following should the nurse monitor as signs of toxicity? A. Diarrhea. B. Hypotension. C. Tremors and tachycardia. Or D. Visual disturbances. The correct answer is C. Tremors and tachycardia. Theophylline toxicity can lead to central nervous system stimulation and cardiac irregularities like tremors, restlessness, and fast heart rate. Question 4. Which lab test should be monitored for a patient receiving warfarin? A. APTT. B. INR. C. Platelet count. Or D. Hemoglobin A1C. Correct answer. B. INR. Warfarin therapy is monitored using the INR or International Normalized Ratio. The target is usually between 2 and 3 for most conditions. Question 5. A nurse is preparing to administer morphine. Which assessment finding requires immediate action? A. Pain rating of 8 out of 10. B. Respiratory rate of 8. C. Heart rate of 98. Or D. Blood pressure of 130/88. Correct answer. B. Respiratory rate of 8. Morphine can cause respiratory depression. A rate less than 12 is a red flag and should be reported before administration. Question 6. Which patient statement indicates the need for further teaching about nitroglycerin sublingual tablets? A. I'll take one every 5 minutes up to 3 doses. B. I will keep it in a glass container. C. I will swallow it with water. Or D. I should sit or lie down after taking it. Correct answer. C. I will swallow it with water. Sublingual nitroglycerin should not be swallowed. It must dissolve under the tongue to be effective. Question 7. A nurse is reviewing the medication list of a patient taking furosemide. What should be monitored? A. Blood glucose. B. Potassium level. C. Urine specific gravity. Or D. INR. Correct answer. B. Potassium level. Furosemide is a loop diuretic and causes potassium loss, which can lead to muscle weakness or cardiac issues. Question 8. A client is prescribed metoprolol. What is the most important assessment before giving this drug? A. Respiratory rate. B. Blood pressure and heart rate. C. Oxygen saturation. Or D. Capillary refill. Correct answer. B. Blood pressure and heart rate. Metoprolol is a beta blocker that can lower both BP and hour. Always assess vital signs before administration. Question 9. Which of the following indicates an adverse effect of gentamicin therapy? A. Tinnitus, B. Constipation, C. Visual disturbances, or D. Tachypnea. Correct answer. Letter A. Tinnitus. Gentamicin is ototoxic. Tinnitus is an early sign of damage to the ears and must be reported to avoid permanent hearing loss. Question 10. Which statement by the patient taking prednisone requires correction? A. I'll take this with food to avoid GI upset. B. I will not stop this medication abruptly. C. I will report mood changes to my provider. D. I can take this medication as needed for pain. Correct answer. D. I can take it as needed for pain. Prednisone should be taken on a fixed schedule and never as a PRN pain medication. Abrupt withdrawal can cause adrenal crisis. Want more board exam questions like this? Follow NurseNextStation and ace that exam, one quiz at a time.